Today, several Travis County commissioners appeared surprised to find out their peers are working on a partnership to build a new diversion center in the county. They've yet to vote on bringing that nonprofit group in, but could do so as early as Tuesday. Diversion programs help connect someone experiencing a crisis. Instead of sending them to jail or the emergency room, the discussion came up during a work session focused on overall diversion efforts today, including one that would look at expanding current resources at the existing sobering center. And KXAN's Grace Reeder has been following this for us, and she's going further in depth now with our very own Robert Hadlock.
Thanks, Brett, and Grace, thanks for coming in this evening. What is the overall goal of a diversion program?
Well, commissioners agree unanimously that they would like to have resources for people who are experiencing a mental health crisis so that they don't end up in jail or in the hospital. How we get there, though, is another story. Commissioners say that one of the items that they talked about today, was a nonprofit group who is trying to bring in fellows, and one of the fellows has already been assigned to creating one of those centers, a diversion center. Some commissioners, Commissioner Shea, who's on your screen there included, were a bit surprised by that, as they have not voted on building a diversion center. The judge there said that that job has flexibility, so the fellow would have flexibility in that job description, but still some commissioners say they feel like that jumped the gun a little bit. The other item that they separately talked about was the idea to focus on expanding existing resources that the county already has. So the sobering center in particular, they'd like to look at expanding the resources that the sobering center already offers to include mental health resources.
What kind of need is there in Travis County for this type of program?
Well, we've heard this discussion a lot recently. Specifically with the city of Austin, it's been surrounding homelessness a little bit more. With Prop B, police officers are going to be interacting a lot more with some of the people in our community who are experiencing homelessness. Commissioner Shea, who I talked to before this meeting today, says that there has really always been a need for these diversionary programs, but especially right now because of the push from the community to reform the criminal justice system in the wake of the George Floyd murder. Here's what she told me before that meeting.
We're not unique in that. I mean, virtually every county around the country, because counties are responsible for jails, all of them are struggling with these issues because so many people in our jails are people who have mental health diagnoses. And everyone is in agreement. That's not the right place.
It is important to remember that this was only a work meeting, so nothing was decided. They didn't vote on anything. We'll get some of those answers on Tuesday, and of course, we'll be following that very closely.
Really important subject. Grace Reeder, thanks so much.